Welcome and thanks for joining us. My guest today is Representative Lauren Underwood, Congresswoman representing Illinois' 14th District in the U.S. House. Congresswoman, thank you so much for coming on with us.
Nick, thank you for having me.
Absolutely. And we're going to talk about the cost of health care and efforts to bring down those costs for Americans whenever and wherever possible. That's something you've focused on. You've been an advocate for lowering health care costs. Can you talk with us about some of the legislation you've championed to make health insurance more affordable?
Well, we know from constituents in my community in Illinois, we know for so many families here in the DMV that healthcare costs have grown out of control, out of reach for so many families. While they may be able to pay their healthcare premium every month to get that insurance card in their wallet, they might not be able to afford to see a provider or get the procedure that they need or even fill their prescriptions. And so one of the bills that I wrote when I first got to Congress was a bill called the Healthcare Affordability Act. And it says that no American would pay more than 8.5% of their income for silver level marketplace plans. And so that's the good coverage, not the high deductible plans that sometimes folks don't want, but these are for people who buy their own health care using the Obamacare marketplaces, okay? And so Joe Biden signed this bill into law in the spring of 2021 as part of the American Rescue Plan. And the way that it works is it gives a more generous tax credit to more Americans, and that's what they use to lower that monthly premium price. And so as a result of this bill being signed into law, 4 out of 5 Americans have been able to purchase a plan on healthcare.gov for $10 or less a month. We saw these tax credits become incredibly popular, and we had the lowest number of uninsured Americans in US history. And now we are in a fight to extend these tax credits because they are set to expire at the end of this calendar year.
So you were instrumental in the creation and extension of those enhanced premium tax credits under the American Rescue Plan. What problem were you trying to solve with those expanded tax credits specifically?
Well, the Affordable Care Act set up this tax credit construct, but the eligibility was determined on your annual income. And so what we saw is for folks that may have been hourly wage workers, if they worked an extra overtime shift, or perhaps if they usually work days and they picked up a couple weekend shifts and they got a little bit of a salary increase for working those weekends, they were kicked off of the eligibility for those tax credits for their healthcare coverage. And then that healthcare plan became unaffordable, right? So let's say, the threshold, I'm going to use a round number. Let's say you could only make $75,000 a year, but because you worked an extra overtime shift, now your annual salary was $75,500 a year, and now your health care plan became unaffordable. We said that that wasn't fair, right? We want people to work. We want them to be able to support themselves. But instead of having a salary cliff, let's tie the amount that they pay for care to a percentage of their income. And that's how we made the change. And it allowed millions more Americans to qualify for these tax credits and get covered. And, it benefits all consumers when more Americans have access to high quality, affordable care.
Can you walk us through a little bit more on how those tax credits have impacted the cost and affordability for people buying coverage through the Obamacare marketplace? Just how effective have they been?
Sure. So we know that the marketplace consumer might be a small business owner or a young adult who's no longer eligible to be on their parents' healthcare plan. And for those two individuals in particular, oftentimes they would have just gone without healthcare, right? And if something tragic happened, maybe they got an unexpected diagnosis, right? Maybe unexpectedly they learned they were diabetic, or unexpectedly they found, skin cancer, or unexpectedly they got in a car accident. They didn't have the healthcare coverage that they need to get the care that they needed. And so then they're stuck with a bill that's unaffordable, right? And so in decades past, that's what drove up the medical bankruptcies that we would see in this country. That's what you were probably familiar with the phrase uncompensated care, right? People would be going to the emergency department because they didn't have a health provider. And, they would have extremely high medical bills that they couldn't pay. Now, those individuals are able to visit healthcare.gov, fill out a simple form, and choose a plan that works best for them. And all of the plans offer what we call essential health benefits, which means that they are going to be able to see a primary care provider. They're going to be able to get their prescriptions filled. They're going to be able to see a specialist if they need one, right? Like that is a requirement of all the health plans on the marketplace. And now, 4 out of 5 of those consumers, so those young people, those small business owners, whatever, are able to get a plan for $10 or less a month. Meaning, you pay $10, you have health insurance, you're able to get all of your healthcare needs met.
So some critics would argue that premium tax credits don't do enough to lower deductibles or out-of-pocket costs in some cases. When you hear that concern, how do you respond to that?
Sure. So what a deductible is with the health plan, they might say you need to pay the first $1,000 of healthcare expenditures that you take on in a year, calendar year, before that health insurance would then start to lower your out-of-pocket costs. That's a deductible. That's different than a copayment. A copayment is when you go into your doctor's office and they say that'll be $25 at the beginning of your visit, right? Sometimes they also call that coinsurance, but it functions similarly. Both of those are examples of out-of-pocket costs that this bill was not designed to address. What this bill was designed to address is to lower the burden of having health insurance at the beginning, right? So to make the price of that premium, that monthly payment just to have coverage more affordable, because that had grown so out of reach for so many families. So an average family is now saving $2,400 a year on their premium as a result of this tax credit. And so depending on the actual plan that you pick, you can pick among plans that have basically no deductible, or what we call high deductible health plans, where it's maybe $2,000 a year, right? That's up to the consumer. But the premium price, 4 out of 5 people are getting a premium for $10 or less a month.
If those enhanced tax credits expire,
Mhm.
what are the immediate long-term consequences for working families? When you look at the consequences, both short-term and long-term, what would the consequences be for working families and the Obamacare marketplaces overall?
So what we would see is that, right, so for this year, 24 million Americans have coverage on the marketplaces, okay? 22 million of them take advantage of these tax credits. So the overwhelming majority of people who are getting healthcare coverage are taking advantage of these tax credits. And so if they expire, we're talking about 22 million Americans who are going to see the cost of their coverage go up dramatically, dramatically, often to an unaffordable level. And so you have to remember why so many people picked these marketplace plans in the first place. They might not be eligible for their own employer's coverage. Maybe they just started with a new job, or maybe they just got laid off from their job. You know what I mean? They don't have employer-sponsored coverage, or maybe they work for themselves. You know what I'm saying? And so
Mhm.
there's nowhere else for them to go. And so that is the immediate and long-term impact. The uninsured rate will increase. People will be spending more money every month on their healthcare. And I believe we will start to see poor health outcomes because people will just go without. They're not going to be filling their prescriptions. They're not going to be getting the recommended procedure. They're not going to be getting the screenings to detect cancer early, or a disease in the early stage where it's more amenable to treatment. And that would obviously lead death rates in this country to increase.
So these tax credits are really a lot more important than most people realize, I would imagine.
They are essential. And guess what, Nick? They are so popular. So Donald Trump's own pollster released a poll in February of this year. His name is Fabrizio, Tony Fabrizio. And he said that for the Trump voter, this was the #1 policy priority for tax reform. So right now on Capitol Hill, I'm in my congressional office. We have been up all night debating with the Republicans, literally starting at 1 a.m., about what is in their tax bill. And my colleagues across the aisle have refused to put these tax credits in their bill. And it's the number one priority for their voters. It's crazy. It is insane. And it's actually deadly, as we've talked about. People need healthcare in this country. These are a popular, important tax credit that allow Americans to get the healthcare that they need. You know, Nick, taking away or reducing tax credits for the cost of healthcare coverage will make the cost of care unaffordable for millions. And the Congressional Budget Office actually released a projection that said that the average 21-year-old would see a monthly increase of $411 if Republicans fail to act. For older Americans, they'd see an increase of $1,200 on the cost of their premiums, right? So when I say dramatic increases, that's what I'm talking about. Hundreds or thousands of dollars just on the price to have that health insurance card in your wallet.
Okay, Congresswoman, thank you so much for your help with this. We appreciate it very much.
Thank you.
She is Representative Lauren Underwood of Illinois' 14th District in the U.S. House. I'm Nick Iannelli. For more information on this series, head on over to WTOP.com and search the Healthcare Agenda.